welcome to Labor Lens. I am Sharon Ijason. On this week edition of the program, we'll continue our conversation on the challenges that health workers have faced in the country. We also have interesting news stories for you. We will be right back. It's the 2021 Roundtable on Social Protection cover. Stakeholders are meeting minds on the need to discuss the possibility for workers in Nigeria to have a social cover that is sensitive to emergencies. The president of the Nigerian Labour Congress notes that the COVID-19 pandemic has exposed the weakness in the current economic model and social protection system, as more than 4 billion persons globally are entirely unprotected against economic shocks.
We demand for a new social contract, including universal social protection cover from our Nigerian political elites. Furthermore, perverse socio-economic challenges, such as high level of economic insecurity, persistent poverty, rising inequality, extensive informality, and a fragile social contract have been exacerbated by COVID-19 and the failure by governments of the world to deploy social protection cover for all. The COVID-19 insurgency has also exposed the weaknesses of the current global economic model and social protection system.
Special guest of honor and Speaker of the Federal House of Representatives, Femi Gbajabiamila, reaffirms the essence of social protection and pledges to ensure policies are made and implemented.
Many of us may not realize it, but there's a strong connection or correlation between lack of social protection, poverty, and crime. What it will take to achieve our best visions for Nigeria and the welfare of all nations' people, of our nation's people. I expect that having secured agreement on what needs to be done, we will then do what is required. I want to assure you that in the 9th House of Representatives, we are committed to using the tools of legislative authority to advance solutions and implement policies that will help achieve the promise of a more perfect union.
Other stakeholders state ways in which social protection cover for all can be achieved.
This is not something we leave for one person. National Health Insurance Scheme is part of it. We're going to expand the coverage, and we even look at increasing the disease conditions that are treatable there under National Health Insurance. So these are the things we can use to fight poverty. And with poverty fight, you can also reduce the money we spend on bullets and aircrafts, because we will have been fighting insecurity too.
Employees, we encourage them to look at voluntary additional contribution if they can afford it. That is one way out. So all these issues have made the CPS, the Contributory Pension Scheme, very unpopular among employees of Treasury-funded MDS, despite the fact that it remains the most sustainable and secure social protection ever. Payment of pensions, my dear people, must be treated with the same priority as payment of salaries if we want to move forward. Attending to outstanding liabilities by government will build and sustain public confidence in the contributory pension scheme. We should stop fighting PENCOM and look to government for our solutions.
The under-declaration of employees, emolument, and staff strength, because during the enforcement process, the 1% contribution comes from the total payroll of the employers. But the employers that are registered in one way or the other do what? They under-declare their staff strength, as well declare lower payroll for their staffs. Then the other one, it's the compliance certificate forgery and fraud by employers. Most of the employers do form or print compliance certificates on their own and send it to BPP. But currently we are in the process to be able to clean. We are cleaning all these things up as at date.
Leadership of the National Union of Air Transport Employees (NUATE) have declared that if the Access Management Company of Nigeria (AMCON) refuses to discuss the fate of the airline workers with the union, its new entity NG Eagle will not take off. General Secretary Ochema Abba explained that as an aviation trade union, NUATE considers the unveiling of the NG Eagle a positive and welcome development, as a new airline would normally create job opportunities, provide incentives for deeper business penetration, and generally widen the Nigerian aviation horizon. He, however, expressed misgivings concerning NG Eagle due to AMCON's evasiveness tendencies on the one hand, and Harrick Air's unrelenting penchant for courting crisis on the other hand, as well as severally demonstrated lack of capacity, disdain for labor relation practice.
AMCON took over Harrick sometime, I think, 2018, if I am correct, under receiver managership because of the indebtedness of Harrick to AMCON. From that period to now, AMCON has dutifully paid all their charges to FAN and all the aviation agencies and all vendors, all suppliers. They are not owing. So AMCON is not indebted to FAN for the period that they have managed Harrick. Yeah. Before the coming of AMCON, Harrick was heavily indebted to FAN and the other aviation agencies. So those are under the legacy debts, which under the receiver managership rules, AMCON is not free to delve into as they were. And you know, that does not pertain to FAN or the aviation agencies alone. There are various vendors, aircraft manufacturers, aircraft salespeople, spare parts vendors, fuel vendors, all sorts of debt, including the workers, the tax authorities, PENCOM. So they are all involved with this debt, and that's a separate issue that I think people should be aware of that.
Do we say they are really on strike? Because as one of the person that goes to government hospitals, prior to this time, the government hospital seems not to exist. In some places you have infrastructure without facility or without personnel. Now having the number of personnel trying to see how we can salvage ourselves from the current issue of COVID, not even available at their desks for advice, because when you get to most government hospitals, the vaccines are not there, the drugs are not there. You are referred to specialist hospitals which are run by these doctors. You know, even government agencies and government individual patronizes private health facilities. So now having the poor man that grapple with nothing to grapple with this incessant strike or current strike by the medical personnel shows clearly that what the government swore to, which is to protect the life and security of individuals, they are failing that responsibility. And the effect is obvious. It's just because we don't have statistics. I'm sure we'll have had a number of people that have been dropping dead, that are sick, all some of this, and we know that we're now going to have medical tourism, both from the medical doctors and also from the people that requires medical care.
If you go to many public hospitals, you see an influx, of people out of public hospitals going to the private hospitals, and that's for people who can afford services in the private hospital. What of the very poor, the indigents, who cannot afford, the exorbitant, charges in the private hospitals? So you will see that it's not the best that should happen to us. So I'm not happy about it. Authorities, they are not doing enough. You imagine negotiations upon negotiations. I've never seen any sign of sincerity on the part of government, the federal government, to resolve this matter, because what these people are agitating for, this is not something that is new. It started a long time ago, but when government, entered freely into agreements and you don't honor such agreements, So you create, opportunity for this kind of situation. Now the government is saying go back to work. With this will be done, that will be done. So, and at the end of the day, you realize that the medical doctors don't trust the government any longer, so they refuse to go to work. Even when there is matter in the industrial court, you see that there is not the kind of spirit you want to see on both sides. I mean the government and the medical workers. But the medical workers, it is sure they don't trust people in government any longer, and that's not too good.
On the Profile interview segment this week, I will be speaking with the National President of the Medical and Health Workers Union of Nigeria, who also doubles as the chairman of JOHESU. He gives reasons why the union decided to extend its ultimatum so that the government will yield to their demands. But so far from our conversation, he said that there might be reasons for the workers in the healthcare sector to proceed on an indefinite industrial action following the fact that their demands have not been met. It's good to have you on the program.
Thank you once again.
Really, once again. Still the same topic, 15 days ultimatum given to the federal government or the governments to ensure that the terms and conditions should be met to ensure that workers do have a better welfare in the sector. Can you bring us up to speed on the updates of your conversation with government, owing to the fact that you suspended action and reissued another 15-day ultimatum?
I'm not going to say I am elated by the developments so far. Why am I saying so? You know, the last 15 days that we extended is also being eaten up. As I speak, we have not started the computation. If by today, the submission or collation of data from the federal health institutions has not been met, and if the committee has been set, Chairman Incomes and Wages Commission is the chairman of the body, the high-level body that has been set up to talk about the adjustments and compute it. But we have not met. And I don't think I would want to say I am happy about that. No, I'm not happy. And we are still saying, we are still calling the Commander-in-Chief, who pleaded with us, who made a plea that we should give the humanitarian window, and that he is willing to pay all debts. And with this slow pace, I don't know how we'll say we are close to resolving the issue.
What more do you think needs to be done to speed up this process, or would you say that government is just paying lip service towards the procedure, or there's no willpower to ensure that the needs and yearnings of the health workers are being attended to?
I want to say that there's no reasonable zeal. The zeal is not really there yet. There's lackluster in everything. What does it take for the Ministry of Health, the parent ministry, to urge the federal health institutions to forward the data that is required to compute the adjusted coins? But I want to say that, to my mind, the ministry is showing that lackluster because it has got some threat from somewhere or one way or the other. That's the way I see it. The ministry is thinking of blackmailing us as strike mongers. And, we have done the press release just a few days ago that we are not strike mongers, and that Nigerians should bear with us if and when we are pushed to embark on an industrial action, an avoidable industrial action. These actions are preventable. And that is why we have been doing what we are doing.
So now, if we are saying that a strike might not be unavoidable at this point, are we looking towards a total collapse of the healthcare system, owing to the fact that we also have a couple of people that are actually on strike at the moment?
I pray we don't get to that point. But if we are forced to, Nigerians should understand. 1 year ago, or 1 year plus now, because it was exactly March 10th that we met with the Commander-in-Chief. And he gave directive, go and settle these issues amicably with JOHESU. As people who do not know, who knows the consequences of a strike action, knowing too well that the public health institutions are the only affordable places for the common people, or near affordable places for the common people to get health care. We still searched for the path of peace. We wrote to the office of the Chief of Staff. And the Chief of Staff in February this year sent a memo to the parent ministry that attend to these issues.
So what would be your demand to the Minister for Health, owing to the fact that the issues of workers in this sector, JOHESU, has been unstable for the past 1 year and there's been no results? What would be, as the chairman of JOHESU?
First, I think I have to make some clarification. These demands have not been on the minister's table or on the federal government's laps for just 1 year. For instance, like the adjustment of currency has been there since 2014. And then we entered an agreement since 2017. Agreement that was flouted. The 1 year plus we're talking about is the directive of the Commander-in-Chief. And so the Commander-in-Chief should ask, should call, not to wait until they come to blackmail us before him. Deliberate blackmail tool. Refusing to adhere to agreements, refusing to even take the commands of the Commander-in-Chief.
So what do you think is the way forward? Because if for more than, since 2014, the issues has been on the table, and we know that the medical doctors actually have gotten significant improvement in their demands since that particular time. The health workers are the ones facing the challenges. They are still the one at work, yet no attention is given unto them. So would you say that there is even disparity between the health workers and the medical professional?
Lots of bias in the handling of issues, very, very much. Now, I think the challenge to JOHESU members is this. They feel that JOHESU members have shown too much concern, too much humanitarian considerations, too much concern for the masses of Nigeria, and so we avoid embarking on strike. There are times that when it is required by law that as essential service rendering departments, that we should just give 15 days and embark on strike. But because of our consideration of these very Nigerians, we will be extending. One of the strikes we extended for 45 days, another was 65 days, and another was 92 days. And right again now, like I told you, since the intervention of Mr. President, we stayed off the strike band up to this period. And rather than rewarding us, rather than attending to our issues, the same government has decided to see us as weaklings.
So would you say that they've seen the health workers union as too lenient, and perhaps you might actually have to do what you have to do to ensure that the welfare of workers in your union or in the sector is being prioritized?
Certainly they have seen us as too loving. So are you doing the challenge since they say we cannot endure hunger, the challenge to the members of JOHESU is to come out where we are forced to doing what we are reluctant to do. come out to tell Nigerians, tell the government that we can endure hunger. JOHESU members will fast.
Apart from President Muhammadu Buhari's decision to intercede at one point or the other, which other stakeholder in the healthcare sector have reached out to the sector to see how you're faring and to see if possible there can be resolution and perhaps maybe you might not opt for the strike option?
Well, recently I think the National Assembly, particularly the House of Reps Committee on Health Services, Honorable Professor Sununu, did invite us. They're trying to intervene, take the right steps to also let those key operators, key actors in the system to ensure that we get some reasonable mileage, so that we can avoid this upcoming strike action or industrial action.
Very quickly, unemployment seems to be on the rise. Underemployment in the healthcare sector also. And so also we have so many people retiring and we don't have new people coming to the system. So there's even this problem many a times of the young ones not even having people to actually mentor them into the system to know how things operate as a stakeholder in the sector and also as a health worker or a health practitioner. How would you react to this? What ripple effects do you think this can have on workers and also in the total system as a whole?
First, let me take it in 2 stanzas. Talking about the mentorship of the young ones. That's more reason why we're talking about the age 65, 70, okay? Retirement age to move from 65 to 70. So that, because there has been some real band of unemployment for some time because of the embargo. And so if we create this, we'll have more, older hands staying back to mentor the young ones that are coming up. That's one. On the other hand, the non-replacements, non-equitable replacement or appropriate replacement of retiring or migrating health workers. When we talk about brain drain, it's not just in one sector of the health system. All arms are brain draining. So overall, as a collateral effect, it goes down to the patients that they don't get what they ought to get. And so monitoring itself by the same health workers may also be down. So I think they need to employ more hands to reduce the worker-patient ratio is very, very germane. And the elongation of the retirement age to keep the experienced hands.
Looking at COVID-19, it's new, it's here with us. What more do you think the government can do to encourage workers who still actually have to work in this precarious situation? Do you think more can be done, especially for those that actually might lose their life in the process of trying to offer care?
In fact, I would want to say here that not much has improved. Maybe the only area where I would say we have some very reasonable improvement is the establishments in the numbers of the molecular laboratories. And even as we're talking about increase in molecular laboratories, have we also employed more of the staff that ought to work in the laboratory? We're talking about the laboratory scientists, the technicians, the assistants. We don't have enough. You open laboratories, and what's the extent of employment? So we are virtually using almost the same strength that we were using when we had about 3 molecular laboratories, even though we are now boasting of, a lot, maybe sometimes 2 per state or 3 per state. But what's the staff strength?
So she's saying that human capacity needs to be improved upon in this sector.
Certainly.
And for those that might lose their life in the process, do you think there should be a special package? Has there been any experience that's been reported to you, and probably the worker did not get what maybe deceased worker didn't get what he or she deserved?
Well, the insurance struggle we've been on is still on. The statements on pages of newspaper and the electronic media is not as deep as it is. It is not so concrete as it is. We are still, they are still trying to work out how best to handle these situations. As I speak with you even now, the review, there's so much hyped review of, upward review of the hazard allowance, routine hazard allowance. I'm not talking about the COVID special allowance. The routine hazard allowance from 5,000 and to be lifted up is still in the, is it on the drawing board? Or maybe...
In the pipeline.
In a broken pipeline. In a broken pipeline. Not just in a broken pipeline. That's why it is refusing to flow out now. You know, it has stuck somewhere. The pipeline is broken and bent, not straight again. So it has stuck somewhere, and it's not flowing out. So that is in the broken pipeline.
Thank you.
Until they straighten the pipeline, then I think maybe we'll get something out.
Thank you very much for your time.
Thank you, TVC, for always helping us to speak out.
And that's all we can take on today's edition of the program. Join us next week for a fresh edition of the show. I am Sharon Ijason. Thanks for watching, and remember that labor creates wealth.